So third up is Fiorella Belpoggi, who is the director, scientific director of Institute Ramazzini in northern Italy. And she has spent about 40 years or more studying the carcinogenic, cancer-causing effects of agents like RF and chemicals on animals, principally rats and mice. Fiorella.
Chiedo scusa. Eh, voglio
I do apologise. I'd like to thank Mrs. Rivasi and Mr. Christoph for inviting me to this very important session because it allows me to speak about what I've been able to see in the report that's being prepared for STOA. This problem of 5G is very complex and I'm going to just put forward my ideas in a very simple language. Perhaps this won't be the language of a scientist who's worked for 40 years on the subject, but I want to be understood and I want to explain what I have learnt because I am a pathologist myself. My daughter used to be asked what job her mother did, and she said she works on mice. And we've been looking at effects on animals in laboratories, and they have been used for risk assessments for many chemical substances which aren't present in the environment anymore thanks to these studies, but which are present but are subject to a good risk assessment procedure. And I do hope that this is what will happen with 5G as well. Now, I looked at these frequencies for 5G, and are they different from the ones used now? That's the question I asked myself. And what frequencies have effects on biological material? What electromagnetic changes are caused as a result of these frequencies? Now, 5G uses 700 to 3,500 megahertz and 26 gigahertz. Now, the first two frequencies are the ones which are used for 1G, 2G, 3G, and 4G, or at least they're similar. So the risks there are similar to the ones we run today. And these risks, as you can see from the report I'm preparing, have been studied in thousands of studies. Only a certain number have shown dangers to health in terms of carcinogenicity and reproduction. And the studies have looked at biological changes, not so much the thermal ones. And the studies have looked at the use of mobile phones and the effects of that on men. Now, the guidelines of ICNIRP aren't sufficient to set an exposure limit which will completely protect us from the effects of these frequencies which already exist alongside those which will be used for 5G, the millimeter waves. With 5G, we're faced with much higher frequencies which will be with us for many years to come, and we don't know what the effects will be in the longer term. So that leads me on to my second answer. What does this mean? It means that, well, there are frequencies which will be used or are already used, which will apply to 5G. We know there is a certain risk for the frequencies already used. It's a low risk. And this covers certain distances. I have been looking at primary prevention, and I have never seen experimental studies showing changes to the cells which haven't been seen to be right. And here we have seen a statistically significant danger to the glial nerve cells. 2 studies have been brought forward independently using independent funds, and they have reached the conclusion that this is the case during the same period. Interphone, etc., looked at major use of mobile phones and showed an increase in tumors and an effect on the acoustic nerves in the ear. So you can understand that there are these problems of pathology, but preparing the STOA report, I looked at the question of whether there was a danger to exposure and how we could quantify this. And what I found out was that there's major uncertainty about the electromagnetic values which will apply to those radio frequencies already used alongside the future 5G. It will be extremely difficult to quantify exposure and to monitor this, and that was confirmed by colleagues in our environmental agency in Emilia-Romagna. So there are so many uncertainties. We have uncertainty about the long-term effects of millimeter waves. We have uncertainty about exposure of the population in general. Can we therefore take final decisions in this situation? I don't think so. Using the data we have at the moment, I think that we would be carrying out a major experiment on the human population, the greatest experiment we've carried out to date. In Europe, we have the REACH system, which is one of the best systems governing the authorization and the sale and the marketing of chemical products. Industry has to study a product, guarantee the safety, and through the REACH system, ACRE registers it. But we don't have this for new technologies. New technologies are used without the appropriate studies on their safety, and I think that's a lack of democracy as far as I'm concerned. So we don't have the experimental data on animals here. We don't have epidemiological data either. If we expose the whole of the population in the world to this, we won't have an experimental group which isn't exposed to compare the effects. So we need to look at policy actions, which I haven't put into my report yet. We need to have certain actions carried out. MEPs need to make sure that the phone companies produce safer mobile phones, because the major exposure comes from mobile phones, and we're putting these in the hands of younger children and pregnant women as well, and all people who might be particularly susceptible. So that's the first step. Then secondly, we have some excellent news for industry. The nerve and brain tumors have been shown up to 50 volts per meter. But at 5 volts per meter, we haven't seen this. The incidence of tumors is identical to that in the control group. So we have 5 volts per meter, which could provide a certain value we could feel is safe. At least there won't be any adverse carcinogenic effects. So it's important to find these doses which don't have an effect. We can't ignore the incidences that there are. We have to manage them, and this is a way of governing the dangers. Third suggestion I'd like to put forward is that we need to look at the missing research. We need to have more research into these electromagnetic fields. We need to see what the effects of the millimeter waves are combined with the other frequencies we have. We need to see what the effects are, because the current frequencies we have do cause a minimum amount of carcinogenesis. We can't just come forward with algorithms. No. As we've seen in studies before, I think that we need to study these frequencies better. Thank you.
Mr. G, the floor is yours.